angina, volume 4, page 122. It occurs at rest and may not respond readily to treatments. Because often indicates severe atherosclerotic disease, it is also called pre-infarction angina and usually indicates patient disease process is worsening. Aldosterone, what is aldosterone? I just went off of the pharmacy one on page 215. It's a hormone by the adrenal glands that causes the retention of sodium in the distal nephron of the kidney. This serves to further increase your blood pressure. 47, what is Wolff-Parkinson-White syndrome and how does it appear on an ECG? The ECG book, page 124 through 126. WPW is the most common type of pre-excitation syndrome and involves pathway or impulse conduction outside the AV node and bundle of His. His or His? It will appear with delta waves, short PR intervals, due to the sloping delta wave, widening QRS complex still within the 0.12 milliseconds, or 0.12 seconds. Name 4 signs or symptoms of hypertensive emergencies. Again, in volume 4, page 133 through 135, there was more than 4 signs or symptoms, so I'm not sure what you're looking for. Confusion, loss of consciousness, stroke-like symptoms, seizures, ECG changes, and pulmonary changes. 49, where is the positive and negative electrode in leads 1, 2, and 3? Right arm's negative, left arm's positive for 1. Lead 2, right arm's negative, left leg's positive. Lead 3, left arm's negative, left leg's positive. What's the predominant risk factor for AAA? Volume 4, page 142, it's the atherosclerosis. 51, what's the ECG criteria for idioventricular rhythms or hyperkalemia rhythm for God? ECG 183, when 3 or more ventricular escape beats occur in a row at a rate of 20 to 40 beats per minute, QRS complexes are wide and bizarre. T wave usually in opposite direction of the QRS complex. What is Frank-Starling law? Volume 4, page 54. The more the myocardium is stretched, the more forceful the subsequent contraction will be. And number 53, name 3 reasons for pericarditis. And that's ECG page 4, bacterial or viral infection, rheumatoid arthritis, tumors, destruction of the heart muscle, and a heart attack.
Charlie, did the volume on the AAA, the volume talk about atherosclerosis and not hypertension at all?
It specifically stated atherosclerosis was the main reason.
So what we talked about in here was hypertension.
Which is also, there's key factors for that too, right?
Right. What we talked in here is hypertension.
Okay.
I did not know that in your volume, so that question that I asked me on your test, I'll go back to you that answer with atherosclerosis, I'll go back and take a look at that.
Okay, number 54. What is the ejection fraction? And that's ECG page 22, the percentage of blood pumped out of a ventricle with each contraction. Name 3 types of rhythms where pacing may be considered, and that's ECG page 245, 246. Symptomatic bradycardia, 2nd degree type 2 AV block, and 3rd degree AV block. 56. What are the reasons for a low ETCO2 on capnography? And I pulled this from one Dr. E. Senior's PowerPoint, and as well as the 10 things you need to know about capnography, which is hyperventilation, pulmonary embolus, pulmonary edema, decreased cardiac output, bad CPR, and tube dislodgement. 57, what are the 3 layers of the heart muscle? Is endocardium, inner layer, myocardium, thick middle layer, epicardium, outer surface. 58, what are the characteristics of alpha 1, alpha 2, beta 1, and beta 2? Page 120, a pharmacology book. Alpha 1 is a peripheral vasoconstrictor, increased contractile force. which is a positive inotropic effect, decreased heart rate and negative chronotropic effect. Alpha 2, decreased catecholamines in circulation, vasodilation and decreased blood pressure. Beta 1 is increased heart rate, positive chronotropic effect, increased contractile force, positive inotropic effect, and increased automaticity, positive dromotropic effect. Beta 2 is peripheral vasodilation, bronchodilation, uterine and smooth muscle relaxation, GI smooth muscle relaxation. What is the relative refractory period? Page 37, ECG. The relative refractory period begins at the end of the absolute refractory period. During this time, some of the cardiac cells have been repolarized to their threshold potential and can be stimulated by a stronger than normal stimulus. Name 4 causes of bradycardia. Page 88, ECG, hypoxia, vagal stimulation, posterior MI, disease of the SA node, hyper or hypokalemia, hypothermia, increased intracranial pressure, inferior MI, and obstructive sleep apnea. I think there was a couple more in there too. What is the algorithm for a patient in SVT? I did write it down so you can look at it, but it's in the algorithm packet. 62, what is the rhythm which is irregular with a rate at 56 a minute, P waves present, PR interval increase with each beat until dropped, beat shortens again with a QRS of 8 seconds. That's page 128, ECG, second degree type 1.
Number 63, what are the characteristics of monomorphic VTAC? ECG book, page 185. VTAC, when 3 or more sequential PVCs occur at a rate of over 100 beats per minute. Rhythm is essentially regular ventricular rhythm. Rate is 101 to 250 beats per minute. P wave is usually non-seen. If present, no set relationship with QRS. There's no PRI interval. And QRS duration is greater than or equal to 0.12 seconds, often difficult to differentiate between the QRS and the T wave. 64, what defines coarse V-fib? The ECG book, page 188. V-fib waves that are 3 or more millimeters high. 65, what is repolarization? The ECG book, page 34. The movement of charged particles across a cell membrane in which the inside of the cell is restored to its negative charge. 66, what is Prinzmetal's angina? Brady, page 122. Vasospastic angina or atypical angina resulting from abnormal spasms of the coronary arteries. 67, what is Einthoven's triangle? ECG book, page 46. Einthoven's triangle is a way of showing that the 2 arm electrodes and the left leg electrode form apices of a triangle that surround the heart. Number 68, what will happen when stroke volume, or what will happen with stroke volume when there is increased peripheral resistance? ECG book, page 22. Peripheral resistance is the resistance to the flow of blood determined by blood vessel diameter and the tone of the vascular musculature. Stroke volume will decrease as total peripheral resistance, TPR, increases. Number 69, what do the chordae tendineae do? ECG book, page 10. The thin strands of connective tissue that are attached to the underside of the AV valves and on the other end to the papillary valves prevent the flaps of the valves from bulging too far into the atria and serve as anchors. Number 70, define cardiogenic shock. Brady, page 135. The most severe form of pump failure is shock that remains after existing arrhythmias, hypovolemia, or altered vascular tone have been corrected. It occurs when left ventricular function is so compromised that the heart cannot meet the body's metabolic demands and the compensatory mechanisms are exhausted. This usually happens after extensive myocardial infarction, often involving more than 40% of the left ventricle or with diffuse ischemia. Number 71. What are the normal times of PR interval in QRS duration? Brady, page 69. PR interval is 0.12 to 0.20 seconds. In QRS duration is less than or equal to 0.12 seconds.
Okay, number 72. Where do you want to keep the EPCO2 for a patient with a head injury and why? 30 to 35 for vasoconstriction, which prevents ischemia or increasing ICP. cardiogenic shock is usually associated with what kind of infarct and how much damage to the left ventricle. Large anterior infarct with 40% damage or more. The left anterior descending coronary artery supplies what portions of the myocardium and conduction system? The frontal branches, lateral, anterior, left ventricle, and septal. Describe the renin-angiotensin aldosterone system and how does it work? Renin is secreted by the kidneys and put into circulation, converted into angiotensin 1. Angiotensin 1 is converted by angiotensin 1 is then converted by the angiotensin converting enzyme and converted into angiotensin 2 into the lungs, resulting in an increase in arterial pressure. At what speed does ECG paper normally record at? 25 millimeters per second. Name 3 ways of determining the rate on an ECG rhythm. 6-second strip times time, 300 method. Small boxes, also called the 1500 method. What is the drug and dosage of choice for torsades rhythm? Magnesium at 1 to 4 grams. Name the right and left AV valves. Mitral, bicuspid, and tricuspid. And number 80, how will the presentation of the right and left heart failure differ? Left heart failure, left ventricle fails as effective forward pump into pulmonary circulation, and right heart failure, right ventricle inability to pump blood into the lungs. Most common cause is left ventricle failure.
Number 81.
Gary, meg sulfate, is it 1 to 2 or is it 1 to 4?
1 to 4.
1 to 4, okay.
81, what is the average
His
amount
slide said 1 to 2.
of blood ejected from the left ventricle, or ventricles? Page 2 of the 12-week book is 70 to 80. Well, it said 70 in there, but we had 70 to 80 in our PowerPoint. 82, what is the normal QT interval? Page 47 of the 12-week book is 0.38 and under. What 2 things does ET with end-tidal CO2 less than 10 tell you of your patient in cardiac arrest? I said poor perfusion and poor predicted outcome. Page Gary. Anywhere find that one. 84. What are the 5 HCPs? Hypothermia, hypoglycemia, hypoxia, hypovolemia, and hyperkalemia. T is thrombin, trauma, toxins, tamponade, and tentamino. I didn't get a page that one either. What is the intrinsic rate of SA, AV, and Purkinje fibers? SA is 60 to 100, AV is 40 to 60, Purkinje is 20 to 40. That was page 16 to 19 of the 12-week book. 86. Name 4 causes of flash pulmonary edema. We got heart failure, coronary ischemia, rapid heart rhythms, and untreated hypertension. I did not get a page for that one either. Name 4 causes of CHF, coronary artery disease, diabetes, cardiomyopathy, and hypertension. No page on that one. Define cardiac output and name the 2 components used in figuring it. Cardiac output is the amount of blood pumped into the aorta each minute. It is stroke volume times heart rate. And normal cardiac output is between 4 and 8 liters a minute. That's page 13 of the 12-week book. And 89, left coronary artery supplies what portion of the myocardium? The lateral surface of the left ventricle and most of the intraventricular septum. Page 12 of the 12-week book.
So, to this point, you've been talking about relative refractory period, and it sounds like a nice classroom type thing. How does it apply to you? Just for anybody.
Well, it could be the cause of like PVCs and stuff like that, correct?
No, not. Oh,
Depends if our drugs will work or not.
no.
Doesn't it affect the trachality? Like if we're gonna shock somebody and the heart's like too tired, no matter how strong you're gonna whack it.
So you could think about it in terms of like an SVT or VTAC, and so the monitor in terms of safety is looking for that R wave. If not, it would hit R on T, okay, which is what we're talking about here. But let me push that rock up the hill a little bit longer. How does it matter to you?
Well, it's the part of the heart that's
I guess, refusing, I guess, so if it's wrong, then we know that we have an infarction or a block, right?
So let's go back to the definition of what you all just told me. You said relative refractory period is what?
If there's a large enough stimulus that it will contract.
Check. So what's a large enough stimulus?
Some joules.
Typically one by itself.
Doesn't it?
It'd have to be an external type stimulus. So what might be an external type stimulus?
A pacemaker,
Huh?
pacemaker.
Nope,
Pacing,
nope.
Medication.
How about somebody that takes a punch to the chest at just the right time? How about somebody that takes a baseball bat or a ball to the chest at just the right time? That R-on-T thing is that it just happens to line up in the perfect setting, that will automatically go from that into a V-fib or a pulses V-tach. So the way that it applies to you is you can get called for somebody that's down, 18-year-old that's down on a ball diamond, that took a shot to the chest at just the right time. I'd be thinking about R-on-T phenomenon, and that's what it's called. That relative refractory period has to have a strong enough stimulus, and usually it's an external stimulus. It's not something in terms of pacemaker or anything else like that. It's not a drug that we give or anything else like that. It's some sort of something that happens to that person.
Now,
Does that make sense?
what was the term for that punch? If you get hit by a ball, there was a name for it.
Yes, thank you. I was sitting here trying to think of a new name to it. Old name is R-on-T. New name, again, John, is what?
Commotio cordis?
Yes, okay.
Okay.
So
Yeah.
how come they always talk about like your precordial thump?
So the precordial thump is only that if somebody is in V-fib and you witness the V-fib.
Gotcha.
And the thought process is you take one shot to the chest, and in that case, you're trying to convert it back into something that looks okay. Make sense? It has a bearing on you folks in terms of possibilities. Will you see it often? No, I probably have seen one or two in my entire career. So it isn't like an everyday event, but be suspicious about it when the lines are adding up. Make sense?